I want you to stop for a moment and think about the last time someone you love was admitted to a hospital. Think about the worry, the exhaustion, the endless stream of paperwork, and the sense that everything was happening faster than you could fully process. Think about the decisions that were made quickly, the forms that were signed under pressure, and the instructions that were delivered in a rush. Now imagine that weeks later, after your loved one recovered and life began to return to normal, an envelope arrived in the mail. You opened it, and the number on that bill, the number at the bottom of the page, stopped you completely cold. This is not a rare scenario. This is not something that only happens to people who were careless or uninformed. This happens every single day to thousands of American seniors who did everything they were supposed to do. They went to the hospital. They followed the instructions. They trusted the system. And yet they still ended up facing financial consequences they were never prepared for. Consequences that threatened their retirement savings, disrupted their monthly budgets, and caused stress that lingered long after the medical issue itself had resolved. My name is Dr. Sarah Mitchell, and I have spent years studying the intersection of healthcare quality and patient financial outcomes. What I am going to share with you today is not meant to frighten you. It is meant to protect you. Because the painful truth that most people never learn until it is too late is this: a significant portion of the financial damage that seniors suffer after a hospital stay is not caused by the illness itself. It is caused by avoidable mistakes. Mistakes that happen before the stay, during the stay, and in the critical days that follow. Mistakes that the healthcare system is not always eager to help you avoid, because in many cases, those mistakes are profitable for the institution and devastating for the patient. Today, we are going through 7 of the most costly and most common of those mistakes. I will explain exactly what each one is, why it happens, what the financial and clinical consequences can be, and most importantly, what you or your loved one can do right now to prevent it. If you are a senior on Medicare, or if you are an adult child helping to care for an aging parent, treat everything I am about to share as essential knowledge. Because protecting your financial health is just as important as protecting your physical health. And by the end of this conversation, you will be far better equipped to do both. Let us begin with the first mistake. And in my clinical judgment, it is one of the most misunderstood financial traps in the entire American healthcare system. When most people think about being in a hospital, they assume that if they are occupying a bed, receiving care from nurses, seeing doctors, having tests performed, and receiving medications, they have been admitted to that hospital as a patient. That assumption feels logical. It feels obvious. And it is dangerously wrong for a significant number of people every single year. There is a classification within the hospital billing system called observation status. When a patient is placed under observation status, they are technically considered an outpatient, even if they spend multiple nights in a hospital room, even if every single thing about their experience looks and feels identical to a full inpatient admission. The distinction is purely administrative, but its consequences are anything but administrative. Here is why this matters so profoundly for seniors on Medicare. Medicare Part A, which covers inpatient hospital stays, requires a qualifying inpatient admission of at least 3 consecutive days before it will cover the cost of skilled nursing facility care following a hospital stay. If you are placed under observation status, those days do not count toward that 3-day requirement, regardless of how long you physically spent in the hospital. This means that a senior who spends 4 nights in a hospital under observation status and who then requires rehabilitation or skilled nursing care may find that Medicare Part A will not cover that post-hospital care at all. Skilled nursing facility care in the United States can cost between $8,000 and $12,000 per month, or significantly more depending on the location and level of care required. There is more. Under observation status, your medications, including medications you were already taking before you arrived, may be classified as outpatient prescriptions rather than inpatient medications. This means they fall under Medicare Part B, or your Part D drug coverage rather than Part A, which can result in substantially higher out-of-pocket costs that many seniors are completely blindsided by. Studies have shown that the number of patients placed under observation status has increased significantly over the past decade, in large part because hospitals face financial penalties from Medicare when inpatients are readmitted within 30 days of discharge. By classifying patients as observation rather than inpatient, hospitals reduce their readmission statistics and avoid those penalties. The patient bears the financial consequences. The hospital avoids the regulatory ones. Every time you or a family member enters a hospital, ask directly, am I being admitted as an inpatient or am I being placed under observation status? Do not assume. Do not wait to find out from a bill. Ask the question clearly, ask it early, and ask it in writing if possible. If you believe you should be admitted as an inpatient, you have the right to request a formal review. You can ask to speak with the hospital's patient advocate or social worker. You can contact Medicare directly. And since 2016, the Notice Act requires hospitals to provide written notification to any patient who has been under observation status for more than 24 hours. Use that notification. Act on it before decisions are made that cannot easily be reversed. The second mistake occurs not on the clinical side, but on the administrative side, and it costs seniors enormous amounts of money every year precisely because it happens during some of the most stressful moments of their lives. When you arrive at a hospital, you will almost immediately be asked to sign documents. Sometimes the paperwork arrives before you have even been seen by a physician. A staff member places forms in front of you and communicates, either explicitly or through their urgency, that your care cannot proceed until these are signed. If you are in pain, frightened, exhausted, or disoriented, and many seniors entering hospitals are at least one of those things, your instinct is to sign and get the process moving. That instinct is completely understandable, and it can be extremely costly. Hospital intake paperwork frequently includes documents that go far beyond basic consent to treatment. Some forms include financial responsibility agreements that establish your liability for costs not covered by insurance, sometimes in ways that are far broader than you might expect. Some include assignments of benefits that authorize the hospital to receive your insurance payments directly and pursue additional billing at their discretion. Some include arbitration agreements that waive your right to pursue legal action in court if billing disputes or medical errors arise. Some include blanket consents to procedures that may not be individually discussed with you at the time of signing. You have the right to ask for a full explanation of every document before you sign it. You have the right to ask what will happen if you decline to sign a particular form. In most cases, hospitals cannot legally refuse emergency care based on a refusal to sign administrative paperwork. If a family member is with you, have them review documents alongside you. Ask for plain language explanations of anything that is unclear. It may feel awkward to slow the administrative process. It is far less painful than disputing unexpected charges months later. The third mistake sits directly at the intersection of patient safety and financial risk, and it is among the most clinically significant issues on this list. More than 40% of adults over 65 take 5 or more prescription medications simultaneously. Many also take vitamins, herbal supplements, over-the-counter pain relievers, sleep aids, and other products with real pharmacological activity and real potential for dangerous interaction with prescription drugs. When you enter a hospital and the clinical team does not have a complete and accurate picture of everything you are taking, the consequences can range from minor complications to life-threatening events. Medication reconciliation is the formal clinical process of comparing what a patient reports taking against what is prescribed during a hospital stay. When this process is incomplete, a medication you depend on for a chronic condition may be inadvertently discontinued, leading to a deterioration that requires additional treatment. A drug prescribed in the hospital may interact dangerously with something you were already taking. A critical allergy may not be communicated across care transitions. Every one of these scenarios leads directly to increased costs, longer stays, additional testing, follow-up visits, and in some cases, additional hospitalizations. Maintain a current and comprehensive medication list at all times. Include every prescription, every supplement, every vitamin, every over the counter product, and every known drug allergy, along with the nature of the reaction you experienced. Bring this list to every healthcare encounter. Review it with every provider. Confirm at every transition of care, from the emergency department to a hospital floor, from one floor to another, from the hospital to a rehabilitation facility, that the list has been accurately carried forward. This investment of time and attention costs you nothing. The consequences of neglecting it can cost you enormously. The fourth mistake is one many seniors are reluctant to address because it feels personal. The belief that asking for help is a sign of weakness or dependency is deeply held by many people in older generations. I want to challenge that belief directly. Having an advocate in a hospital environment is not a sign of weakness. It is one of the most strategically intelligent decisions you can make. A single admitted patient may be seen by a primary attending physician, multiple specialists, a hospitalist, a pharmacist, nurses across several different shifts, a physical therapist, a case manager, and a discharge planner. Coordination between all of these professionals is not always seamless. Information conveyed to one team member does not always reach another. Instructions given verbally may be misunderstood or incompletely documented. A patient who is alone, unwell, fatigued, or medicated is at a genuine and significant disadvantage in that environment. A capable patient advocate does not need to be a healthcare professional. They need to be present, organized, and willing to ask questions. Their role is to take notes during medical discussions, ask for clarification when something is unclear, verify that information is consistent across providers, and raise concerns when something does not seem right. Research in patient safety consistently shows that patients with engaged family advocates experience better outcomes, fewer medication errors, and shorter hospital stays. Identify your advocate before a planned admission. Document their authorization to speak on your behalf in your medical chart. If you face an unplanned admission, contact a trusted person as soon as you are able. The benefits of that support, both financial and clinical, are well established. The fifth mistake is tied to a cultural tendency that is particularly common among older generations: the tendency to defer without question to medical authority. Respect for medical expertise is appropriate, but deference is not the same as informed consent. And informed consent is both your legal right and your most powerful tool for avoiding unnecessary costs. Every test, procedure, scan, consultation, and transfer that occurs during a hospital stay generates a charge. Some of those charges are essential and directly tied to your diagnosis and treatment. Others are precautionary or routine by institutional protocol, or recommended in ways that are not always fully explained. When patients accept every recommendation without asking any questions, they sometimes undergo tests and procedures that are not strictly necessary for their specific situation, each of which adds to their bill and occasionally to their clinical risk. When a test or procedure is recommended, ask what specific information it will provide and how that information will change your treatment. Ask whether alternatives exist with similar diagnostic value but lower risk or cost. Ask what the consequences of declining would be. Ask whether the service is covered by your insurance and at what cost sharing level. For seniors facing a recommended transfer to another facility, ask about quality ratings. Ask whether that facility is in network with your insurance, and know that in most circumstances, you have the right to request a different facility altogether. Informed patients make better decisions. Asking questions is not disrespect. It is your right and your responsibility. The sixth mistake catches people at their most vulnerable moment. Discharge from the hospital feels like a victory. You survived. You were treated. You are going home. It is a moment of relief and exhaustion. And it is also one of the most information-dense moments of your entire stay. Hospitals are under institutional pressure to discharge patients promptly, which means discharge can feel rushed. A nurse or case manager may arrive with a stack of papers, move through them quickly, and ask if you have any questions, while clearly communicating through their pace that there is not much time. Medications may be listed without clear explanations of what changed from your pre-admission regimen. Follow-up appointments may be scheduled without confirming that transportation is available. Warning signs that should prompt a return visit may be described so quickly they fail to register. Patients who do not understand their discharge instructions are significantly more likely to be readmitted within 30 days. Readmissions are financially costly, clinically disruptive, and emotionally exhausting. Before you leave, ensure you have a complete list of current medications with a clear explanation of every change. Confirm all follow-up appointments and understand why each one matters. Know precisely which symptoms should prompt you to call your doctor or return to the emergency department. If anything is unclear, ask again and ask for the answer in writing. Many hospitals have social workers and case managers whose specific role is to ensure patients can manage safely at home. Use those resources before you walk out the door. Now we arrive at the seventh and final mistake. And in terms of pure financial impact, this may be the most significant of all. The first six mistakes can lead to unnecessary charges appearing on your bill. This one involves paying those charges without ever examining whether they are legitimate. Medical billing in the United States is among the most complex administrative processes in any industry. A single hospital stay generates an enormous number of individual line item charges across multiple billing departments, processed through multiple layers of coding, insurance submission, and adjudication. Given this complexity, billing errors are not an exception. They are common. Duplicate charges, fees for procedures ordered but never performed, incorrect room and board classifications, upcoding, where a service is billed at a higher complexity level than documented, and charges for supplies that were bundled into another service but billed separately. All of these appear on hospital bills with significant regularity. Request a complete itemized bill. Do not accept a summary statement that simply lists a total amount. Request a full line-by-line breakdown of every service, supply, medication, and professional fee charged during your stay. Compare it against your own records. Verify dates. Look for services you do not remember receiving. Look for items that appear more than once. If something seems incorrect, contact the billing department directly. Many errors are resolved through a straightforward conversation. If the billing department is unresponsive, contact your state insurance commissioner or file a complaint with your state health department. If you are on Medicare, contact your state health insurance assistance program, known as SHIP, for free assistance reviewing your bills and your Medicare summary notice. Some seniors recover hundreds of dollars through this process. Some recover thousands. The effort is modest. The potential reward is significant. The patients who fare best, both clinically and financially, are the ones who refuse to be passive. They ask questions, even when it feels uncomfortable. They bring advocates, even when it feels like an imposition. They review their paperwork, even when it feels tedious. They verify their medications, even when they assume everything is already correct. They take discharge instructions seriously, even when they are eager to go home. And they examine their bills carefully before they pay them. These behaviors are not complicated, but they require the conviction that you have both the right and the responsibility to be an active, informed participant in your own healthcare. That conviction, combined with the specific knowledge of what to watch for and what to ask, is exactly what I hope this conversation has given you today. Your health is your most valuable asset. The savings you have built over a lifetime of work deserve the same protection you give to everything else you value. By avoiding these 7 mistakes, you can ensure that a hospital visit strengthens your health rather than threatening your financial security. Thank you for spending this time with me today. If this information was valuable to you, please subscribe to this channel so you never miss a new video, and share this with a family member or friend who might need to hear it. On this channel, we give American seniors the healthcare knowledge they need to protect their health, protect their savings, and live with greater confidence and independence every day. Until next time, stay informed, stay protected, and take care of your health.